Good afternoon. My name is Michael Decker, and I'm an assistant professor of orthopedic surgery at the University of New Mexico School of Medicine. And I'm looking forward this afternoon to talking to you a little bit about hip arthritis. A little bit about myself. I did my undergraduate work in Boston at Boston University. I did my medical school in Illinois, where I grew up at the University of Illinois, in Chicago. I came to Albuquerque in 2012 to do my residency training in orthopedic surgery at the University of New Mexico. Left for a little while to go to Canada to do a fellowship in hip and knee replacement surgery, and then came back recently to start working at Sandoval Regional Medical Center, where I do hip and knee replacement surgery currently, since 2018. I have a number of partners I work with through the University of New Mexico system: Dr. James Ninamiya, Dr. Sam Urkakish, Dr. Rick Gaylert, and Dr. Dan Washer, also hip and knee replacement specialists. So the goal of my talk today is predominantly to talk to you about hip arthritis and give you some sense of what exactly hip arthritis is, how it impacts you in your daily living, and ways we can effectively treat it to try to get you back to the quality of life that you would expect to have. So hip arthritis comes in many different forms. The most common form being called osteoarthritis. It's probably a term you've heard a number of times before. Although some people have heard terms like rheumatoid arthritis or inflammatory arthritis. These are also forms of arthritis of the hip, and they all cause very similar symptoms. The problem with arthritis is that it takes the smooth surface of your joints, like your hip, and they wear out, and the surface wears off, and it causes a lot of pain in the joint, which can be very debilitating. The main symptoms of arthritis are really pain. That's the most predominant symptom that patients deal with when they start presenting with this problem. And pain can occur in a lot of different places around the hip, but the most common places that hip arthritis presents pain is in the groin region, sometimes in the buttocks region, and even down to the knee on that same side. So it can present in a lot of different ways. And that pain is usually worse when you're active, up and walking, or getting up and out of chairs, trying to climb up and down stairs, and sometimes might get better with rest. But frequently it's there and it's constantly lingering in the background. There's a lot of other symptoms you can get with arthritis of the hip. In particular, a lot of patients will notice that they get very stiff. They feel a lot of stiffness in the hip. And that sometimes shows itself as decreased ability to move the hip in ways that you used to be able to do prior. This can be really troublesome for patients and people because they have the inability to bend over and tie their shoes, or put on their socks, or get dressed, or reach for objects that may have fallen to the floor. This can all be caused by that stiffness from the arthritis. And even more troubling for some people is that they feel and can hear a grating sensation in their joints. So they may notice that as they walk, they feel a grinding and it hurts. Or every time they move their hip in a certain position, they can hear a pop. That can be quite troublesome to experience. So these are all very common symptoms of arthritis, but the most important one that you need to talk about is the pain, because this is what really changes people's lives and function. There are a lot of reasons that hip arthritis can occur. The most common reason is actually we don't know why hip arthritis occurs. It's idiopathic, meaning it just presents itself. It occurs over time. But there's a lot of reasons that you could get it that you can point to, such as repeated stress on the joint, such as high impact sports or heavy labor work. People who have had these experiences in the past may notice that they go on to develop significant pain from arthritis. Some people have an injury to the joint. They were in a car accident, or they fell and broke something in the past. Those injuries can eventually lead to that cartilage wearing out and developing arthritis. Some people are born with some abnormalities in their joints that they may not even know about that could lead to arthritis. They've been living with it their whole life, they just didn't know it. And of course, there's other factors that may contribute it, such as simply time. Over time, like anything that's mechanical, you use it enough, it wears out. So as people age, they start to develop arthritis in their joints. And there's other factors such as increased body weight that may increase the force in the joints that could lead to arthritis. And there's many, many others, but those are the most common reasons that people go on to develop arthritis in their hip. When you start to develop these symptoms, it's really important to talk to your doctor about what you're experiencing. Pain that doesn't seem to go away and seems to slowly get worse over time is something worth talking to your doctor about. and it's usually some of the first signs that you're developing arthritis. And it's important you talk to your doctor about what those symptoms are like. So when you see your doctor for the first time, tell them about when the pain started, what you were experiencing when you first felt the pain, things that made the pain better, things that made the pain worse, what activities you can or cannot do because of your pain. And it's really important you do that because we need to know as physicians what your expectations are for the way you want to be living and how we can help you get back to that and make your pain manageable. And it's really important you talk to your doctor and be very honest with your doctor about your health. What kind of health conditions do you have? What are you being treated for? So we can figure out what options are best for you when we decide on treatment options. And do expect when you go to see your doctor to get a full set of x-rays. It's by far the best thing we can do to diagnose the problem is a good set of x-rays of your hips. So understanding your hip x-rays, you'll have an opportunity when you see your doctor to look at your hip x-rays. And I think you should take a look at them. There's a few changes that occur on those x-rays that you'll see that will tell you, yes, I do indeed have arthritis, and this would explain why it hurts so much. So take a look at this image here. What you can see is that in the normal hip, there's a nice space between the ball and the socket, and that's normal. That's where the cartilage lives. You can't see it on x-ray. So space is good. But that space disappears as the cartilage wears out, so the joint space narrows. That's a good sign that you are developing arthritis. Your body also has a couple other reactions in the bone around the hip joint that tell you that there is arthritis occurring, such as bone spurs or little cysts or fluid-filled pockets within the bone. Those are also very strong indicators of development of arthritis in the hip. So an x-ray like this would show you pretty clearly that this particular person has gone on to develop arthritis, which helps us guide treatment for your pain. So how do we actually treat arthritis if you've gone on to develop it? There's a lot of options that are available to you. The most important thing to remember is that the goal of treatment of arthritis is controlling pain. We can't make your cartilage come back, unfortunately, and the good news is you're not going to wear it out any faster by being active and doing the things you want to do. The goal of treatment is to make your pain manageable and get you back to the quality of life that you would expect. So there's a lot of ways that could happen. We can use medications, such as over-the-counter medications or prescription medications. The best medications we have to treat arthritis are anti-inflammatory medications. Certainly not everyone's able to take those. There are certain health conditions that would prohibit you from taking those. But for the most part, it's a very effective treatment for many people. Some examples include ibuprofen, naproxen, or prescription medications like Celebrex or meloxicam. But there's many available on the market that may be able to help get your pain under control. Another very common treatment option is actually to use a device to help you walk, an assistive walking device. An example of this might be a cane. And canes work remarkably well when you put them in the opposite hand of the side that hurts. So if your left hip is hurting, put the cane in your right hand and see how it helps you walk. Decreasing the amount of force on your hip joint while you walk and offloading that can really help you get around a lot better. And that may not fit everyone's lifestyle, and that's important for the doctor to know as well. There's also some other options like physical therapy. It seems somewhat counterintuitive. If my hip hurts, why do I want to be more active on it? That's just going to make it hurt more. Well, the good news is that the more you move the joint, the more you strengthen the area and stretch out all that angry tissue around your hip, it actually helps the pain decrease over time. Physical therapy is an investment, though. It takes a good 6 weeks or more to start to get the benefits of that physical therapy, so stick with it. It is worth it. It's one of the few proven treatments we have to really improve arthritis-related pain. Low-impact exercises, swimming, cycling, even walking and hiking, the relatively low-impact activities that can really help improve your symptoms. And then, of course, there's options like injections. You may have heard of these in the past, something like a steroid injection. The goal of these treatments are to put an anti-inflammatory or pain-controlling medication directly into the area that is causing the pain. For some patients, these can be extremely effective at pain control and allow them to get back to those activities they enjoy. And so we keep these as options available to us to treat your hip arthritis should you need it. When these treatments don't work very well, however, and that happens somewhat frequently, over time these treatments might not effectively control that pain, we start talking about something a little bit more definitive, or long-term for that pain control, and that's when we talk about surgery. And that surgery would be hip replacement surgery. It really is an excellent option for certain groups of people. And what I often will tell people who I meet for the first time is that it's a good time to talk about hip replacement when you have hip arthritis that we can see on an x-ray. That arthritis and that pain is really interfering with your quality of life and the activities you expect to be doing. And you've tried treatment for it that is not quite as invasive as a hip surgery, like those medications or injections or therapy, but they're not cutting it. They're just not getting you to the point where you feel like your quality of life is where it should be. If you can say yes to those things, that's a good time to start talking about hip replacement surgery. So what exactly is hip replacement surgery and what can you expect from it? Well, the idea behind hip replacement surgery is that we remove the regions of the bones that have become abnormal because they lost their cartilage, and we replace them with mechanical parts. And those mechanical parts reproduce the same looking structure as the bone that we removed, but they're now made out of metal and plastic that allow the joint to move very smoothly through a good range of motion and get rid of those surfaces that keep rubbing together that create the pain that you're experiencing. And the good news is, from the standpoint of a surgery, this is a very successful surgery. 96% of patients who have this operation have an excellent outcome and are very happy that they had it done. And in terms of how long you can expect something like that to work for you, it's hard to say for everybody, but common implants these days last for a very long time. So the hope would be that after you have hip replacement surgery, that can stay with you for the rest of your life. The good news about hip replacement is it markedly improves pain. It will not return you to that same hip motion and function that you had when you were 20, but it can really change your life if it goes well. There are certainly risks to surgery, however, and that's why we always save surgery for the final treatment. We don't go right to surgery. We try these other treatments first. There's the possibility of things like blood clots, infections, bone fractures, hip dislocations, and even differences in leg lengths after surgery. But we wouldn't offer surgery if we didn't think we could possibly benefit you with offering it to you. And so we weigh those risks against the benefits of the surgery, and we come together, patient and surgeon together, to make that decision if that's the right thing for you to do. I wanted to talk to you a little bit about what it looks like to have hip surgery and what to expect from the recovery, because I think that always is a point of anxiety for many people. What's it going to be like after hip surgery? What's my life going to look like? The good news is, as we've gotten much, much better over the years of taking care of people and getting them out of the hospital, we've also gotten the recovery phase to shorten quite a bit. So the hospital stay. Most patients are going home, sometimes the day of surgery, sometimes within a day after surgery, as long as they have the right things around them, like good family support or friend support, someone who can help take care of them at home during the first few weeks after surgery. Some people may not be able to go home after surgery, and they might need to go to a nursing facility or a rehabilitation facility. And that's okay. We want to make sure that if we're going to do this surgery, we do it right, and that you get go to the place you need to go to have the recovery that you need. Pain after surgery is by far the greatest anxiety people experience after surgery. And the good news is, generally, most people who have hip replacement surgery actually have a reduction in pain after surgery. They're usually sore around where they had to have the surgery done, but that pain they've been experiencing that's been debilitating for so long usually goes away pretty quickly. However, the first few weeks generally tend to be the most painful, and we help get you through that. We've got a lot of different ways we can help get you through that. And quickly over time, your pain starts to get better, and you start getting back to those activities. When do you return back to the baseline that you were at before all this hip pain started? I would say most people are back on their feet, getting back to doing activities like walking or hiking, usually within anywhere from 6 to 12 weeks after surgery. Everyone's going to be different, so I try not to put too hard of a number on that, but that's a pretty good range to estimate when you can expect to be back on your feet and living a mostly normal life after surgery. And driving, this is always a point of concern for many people. Expect to be driving something along the lines of 6 weeks after surgery. So the important thing to remember about hip arthritis is that hip and sometimes knee pain that is not going away can be a sign that you've developed or have worsening hip arthritis. It's really important to tell your doctor about that and about the nature of your pain. Give as many details as you can so that the doctor can work with you to come to the best decision about what treatments are available for you. There are a lot of treatments that are available, and some of them may work for you and some of them may not. The important thing is give them a try, see what we can do to get that pain under control and get you back to the activities that you want to be doing. If none of those treatments work, do remember hip replacement is a really good option. It's very successful. It can get you back to a sustained kind of quality of life and a very reliable pain control for the long term. And the good news is hip replacement has really excellent long-term outcomes. If you had to have a surgery, it's a good one to have. So I thank you for your time. I appreciate your attention. And if you have any questions, do not hesitate to reach out. We'd be happy to talk to you about your painful hip. Thank you.